The stool test for blood is also known as fecal occult blood test, or FOBT. To do the test, you collect a small stool sample at home from 3 separate bowel movements to send to the doctor's office or lab. The samples are tested for traces of blood in the stool. Blood in the stool does not necessarily mean you have cancer. Blood could come from non-cancerous conditions like bleeding hemorrhoids, or from polyps, or from cancer. The stool test for blood takes little time. It's not physically uncomfortable, and it is the only screening test you can do at home.
Well, having to take the little stick and sample your stool when you have a bowel movement is not something that people would normally do, but it's not that bad.
The fecal stool test, I found nothing surprising other than it was a little bit gross. I didn't expect that on the first test. I thought it was a one-time procedure, 1 day, 1 sample. And to do this 3 days in a row, it wasn't very pleasant.
The stool samples are very small, taken with tiny swabs. Placing plastic wrap over the toilet can help in taking the sample. Afterwards, the sample is packaged and often can be sent by mail to the doctor or lab.
I think having the stool test is easy and it's not invasive, and you don't have to go to the hospital or go back to the doctor's office and have something that takes longer or may be uncomfortable.
Some people confuse the stool test for blood with a digital rectal exam, in which a physician inserts a gloved finger into the rectum to check for abnormalities. The digital rectal exam, or DRE, is not a good way to check for colon cancer, unlike the stool test for blood, which is a recommended screening option. The stool test for blood should be done every year in order to be effective at reducing deaths from colon cancer. In about 5 out of 100 people, blood is detected in the stool. When this happens, another test called a colonoscopy should be done as a follow-up to see if the bleeding is caused by a polyp, by cancer, or by something else. In a colonoscopy, a tube is inserted in the rectum that allows the doctor to see inside the colon and remove tissue if necessary. We'll talk more about colonoscopy later.